Are you distracted? Are you talking to someone? So if that's so, we're going to ask that you remove yourself from the distraction, because there's so much great information will be shared tonight. And oftentimes what happens is after the sessions, then people are in the chat asking what was discussed, or I did ask and answer, but I didn't hear the response because I was distracted. So I want you to get into that frame of mind and be ready to be fully involved and just to be intentional, with being here. If you want to have your pen and paper ready to take notes, by all means, we want you to do that. So my question to you tonight is, are you feeling overwhelmed or anxious? Just to stop and think about how you're feeling right now. So for 5 minutes, you could either step away or close your eyes, or just to think about how you're feeling. And to take some deep breaths, just to ground yourself and reflect, and then return with more clarity. If you want to lean back, whatever it is that you want to do, you could do that now. So remember, instead of pushing through stress, just choose to pause. Close your eyes. Now, these small resets restore your energy, reframe your mindset, and help you respond more calmly. And I want you to ask yourself, what triggered my stress today? Were you feeling stressed out in any way? Did someone annoy you? Did your food get burnt? What triggered your stress? And also, how did you respond to that stress? Did you scream? Did you walk away? Did you take deep breaths? The next question, how did you feel after taking just a few mindful minutes for yourself? So now that we're doing this mindful piece, how do you feel after taking a few mindful minutes for yourself? And next question, what signs does your body give you when you need a reset? So is your body telling you to go eat some food, go take a nap, take a drink, go for a walk? Like, what does your body tell you when you need a reset? So the takeaway for tonight is that stress is a part of life, but how we respond is within our control. With just 5 minutes, you can reset your nervous system, shift your mindset, and return to your day with more clarity and calm. So these mindful resets, they don't take time away. You know what they do? They give it back to you with greater focus and emotional freedom. So, again, just a reminder to take time out for yourself and to press that reset button. And as you participate in these challenges and you listen to these seminars, you will understand, the doc will talk about your parasympathetic nerves. You will understand how all that comes into play as you heal your body, both mentally and physically. Over to you, Sandrine.
Okay, thank you for that, Paula, aka Sister Wellness. It's always so important for us to take the time to breathe, and I know our community enjoys the breathing exercise that we normally do. Without further ado, I'm gonna hand over to Dr. Thomas, who will do his presentation tonight on the metabolic syndrome and this is part one in a series that we are starting this evening. So, welcome to everyone on, and welcome to Doc, our fearless leader. So, I'll hand over to you, Doc.
So, good night, everybody. Hope you're all hearing me clearly. I'm having some computer issues, but I doubt it will dampen our spirits or prevent you from hearing the awesome information that I'm about to share. Welcome to everybody here. Welcome to our first presentation of the year, I think, Sandrine. I think this is the first seminar we're doing for this year. And as you heard, we're doing a series, and this is number one in a 10-part series that I'm really excited to share with you. Let me just take a moment to go live on my other platform. We're already streaming live on YouTube. I'm going to also be streaming live on TikTok. Let me get that stream running. I wanted to start that while I started talking. Give me 1 second. I know some persons are waiting for this live to go on. So I'm going to try to keep the presentation as concise as I can. It's a lot to share, and I don't want to shortchange anybody this evening. So yes, so we're going to be talking about, for the next 10 presentations, the metabolic syndrome. And some of you may never have heard of this. You're going to hear about it tonight, and you're going to learn a whole lot. This is the product of a lot of research on my part. You know, as a medical doctor, we believe in continuing education. And all of my colleagues and myself continue to invest time and effort into reading the latest research, reading the latest books, and hearing from the experts. And I've been doing so in my area of functional medicine. And do I have a lot to share about what's coming out and what's new and what's our current understanding of how to best take care of yourself, whether you're sick or not. You will need this information to prevent what might come upon you, or more importantly, for some people, to reverse, which is my new tagline on TikTok. Reverse it is the tagline for this year. And so we're going to talk about the metabolic syndrome. Now, the 10 presentations that I'm going to be doing are going to be twice a month. We're going to be taking basically about 5 months to do the 10 presentations. So as not to overwhelm you and to give you enough time to digest the information and to make the adjustments. The information or the presentations will focus on a number of key related topics, all related to the metabolic syndrome and insulin resistance. We're going to be talking about diabetes, hypertension, PCOS, many cancers. We're going to be talking about high cholesterol, sleep apnea. We're not going to just talk about them. I'm going to be sharing information with you that we now understand how we can not just treat, but reverse many cases of these illnesses and prevent many persons from having to live on medication for life. We're going to be talking about, very importantly, obesity and what is our current understanding of why you get fat and why you can't lose weight. Now, as you know, I've been doing these challenges, 90-day body reset, 14-day flat belly challenge, 21-day flat belly challenge for the past couple of years. 90-day came around last year, and we've helped lots of people. Now, with the current information I'm going to share, you're going to be better be able to take care of yourself, understand why you're doing what you're being asked to do and why it works and what not to do and what are the pitfalls that you might experience. So I'm really excited to kind of open up to you guys this evening the underpinnings of our programs and the underpinnings of your body. Now, I know tonight some of my medical colleagues are joining this presentation to hear what I have to share. So in an attempt to satisfy both audiences, both the medical personnel and lay persons, I've tried to do a presentation that has a little bit of both simple basic information, but some hard science. I will try to keep it at a level where most persons can understand, but if something goes over your head, just make a note of it and ask about it later in the presentation where I can further explain what's happening. Let me see if I can get my slides going here. Having a little challenge with this now. Okay, yes, we are up and running. Excellent. It's moving rather slow though. I'm not seeing the first slide coming up yet, so let's give it a little bit of time. One sec, guys. Anyway, so let's talk about the metabolic syndrome since the slides are not working so well at this point. The metabolic syndrome is a term coined from as far back as 1988 by Dr. Raven. And there's a research that's on second slide, which he published in 1988, where he described the metabolic syndrome as a cluster of conditions, and I'm hoping to get the slides up, that seem to coexist together over and over again. We tend to see these things, and he understood that they occurred together because there was an underlying cause. It was one single reason why they were happening together. I'm not sure what's going on with my slides, guys. Give me a second here. Let me see what's going on with my Gamma software here, which I used to do my presentation to make it nice and pretty for you, but it's really, let me just try to download it, maybe. No, it's not working. All right, no one comes up. All right, so it's kind of coming up now. All right.
We're seeing it now.
All right, great. And it's gone again. Not sure what's going on with it, why it's moving like that. All right, so yeah, so Dr. Raven, 1988, described the metabolic syndrome as a group of conditions that seem to go together because he found that they had an underlying cause. And just gonna get straight to the point. The underlying cause is something we call insulin resistance. Before the term metabolic syndrome was coined, we used to call it syndrome X. But before syndrome X, it was called, in fact, the insulin resistance syndrome. And I kind of preferred that name. That was before my time, 1988. I was still a 10-year-old, but the insulin resistance syndrome preceded 1988. And what it did was to help people to understand the cause and what they could do. Now, the metabolic syndrome might be more scientifically preferred, but it does not tell the layperson what to do about this problem. So I would hope someday we would go back to that original nomenclature and call it what it really is, the insulin resistance syndrome. Now, we found that if you had this syndrome, which included a number of things, overweight, cholesterol or lipid problems rather, blood pressure issues and blood sugar issues, it really predicted your likelihood of getting cardiovascular problems, i.e. heart disease and stroke, type 2 diabetes. And we found it wasn't just a single organ problem or separate entities like we want to look at it these days, because we look at these persons as having 5 separate diseases: high blood pressure, diabetes, high cholesterol, and treat them with different medication. And that misses the important point that there is one singular cause. And if that singular cause is addressed, then the disease of insulin resistance, of metabolic syndrome, all of them fall like dominoes on a table. That's what the groundbreaking information that I'm bringing you here tonight. Yes, you can reverse all of these illnesses once you understand that it's not medication that you necessarily need. The medications may be short-term, life-saving in an emergency. Your blood pressure is sky high. I had a guy today, blood pressure was 220 all over 180 over 118. Yes, at that level and it was high for a while. He had some kidney damage. He needed some medication right there and then. But that will not get rid of his blood pressure. He'll have blood pressure forever if you continue medication and do not address underlying causes. Now, here's a good reason why you might want to pay attention this evening. Those of you on TikTok are not seeing the slide. And if you're on TikTok and you're not seeing, just follow the page and you will get a link where you can actually view the presentation. And it's also live on YouTube. Just follow the page now and you'll be able to get that link. All right. In 2024, the leading cause of death in the United States and by extension worldwide was and has been for many years and still is this year heart disease related to the metabolic syndrome. Cancer came second, and as you would have heard earlier, and I'll make the link later on in the year, cancer is related to the metabolic syndrome, especially breast and prostate cancer. Number 4 on the list was stroke, a cardiovascular illness related to metabolic syndrome. Go down to number 6, you see Alzheimer's disease, which is dementia related to the metabolic syndrome. Below it is diabetes, definitely metabolic syndrome. Kidney disease, definitely metabolic syndrome. So, 5 or 4 of the top 7 causes of death worldwide are related to metabolic syndrome. So this is kind of important that you all know about it, because all of you either have it or know somebody who has a metabolic syndrome. And so we're going to try to define this evening so you know exactly what we're talking about and what to do about it. More importantly, I'm trying to get to my next slide. Give me no ends of problems here. This is just not smooth at all, my friends. All right. So how do we define the metabolic syndrome? It's 5 criteria, 4 highs and 1 low. This very simple way of looking at this. So originally, it was defined by 5 things. So it was described by 4 highs. 1 high was your waist circumference. If you're a man, you had a waist circumference at your navel over 40 inches, or a woman over 35 inches, that's 0.1. If you have a blood pressure, so high blood pressure is the second high, blood pressure of 130 over 85 or more, that was one of the criteria. Your fasting blood glucose was another one. If you had a high fasting blood glucose of over 100, which is about 6.1 thereabout, that was another criteria. If you had a high triglyceride level over 150 milligram per deciliter, that's a criteria. And the 1 low was your good cholesterol, HDL. If that's low, then that's a criteria. If you have 3 out of the 5, then you by definition have metabolic syndrome. But this was a very old definition. You still use it. Back in 2005, thereabout, it was first published, Grundy et al. And we find now that there are additional things, the additional diseases that we are finding that are related to metabolic syndrome, which you want to consider in your diagnosis when you're making this designation as a physician. Now, metabolic syndrome is a worldwide phenomenon. Worldwide, 25% of adults have this. It's the most common condition worldwide. I cannot think of anything else that 25% of the entire adult population worldwide, not even COVID was this popular. And this does not depend on country. Even countries like Japan and China and in the Far East and Middle East and the Western world, South America, Central America, Caribbean Islands, every single country on planet Earth has manifestations. The more rural, the more closer these people live to nature, the less of it they have. The more urban, the more modern lifestyle that we have, the more modern fast foods we eat, the higher. That's giving some clue. In the Caribbean and US, we are closer to 30-odd%. US is 37% prevalence. It's estimated that in the United States, 1 in 8 persons are metabolically healthy, and we're not far behind that in the Caribbean. So it means 7 out of 8 persons have some degree of metabolic inflexibility or problems. It's really, really common that we are getting metabolic issues, and some of us are metabolic syndrome, some are on our way to getting it. Now, I want to today introduce you again to my approach, my framework of thinking about medical problems. It's a functional medicine approach because I am a functional medicine doctor. So I approach diseases not from what's wrong with you, but why. not what disease you have, but why do you have the disease? What is the underlying reason why you're feeling ill? I don't want to know whether you have blood pressure so I can give you blood pressure medication. I want to know why is your blood pressure high so I can get rid of the problem, the cause, and solve it. And so for metabolic syndrome, it's no different. We take the same approach to solving these problems. We understand that metabolic syndrome has, as it is underpinning problem, a high insulin. I'm going to go into that in detail in a minute. We also have high inflammation, gut health issues. There are a whole host of problems that definitely contributes to metabolic syndrome. It's not a simple concept. It's not a simple one-liner. There are a number of different levels of abnormalities that I'm going to now open up your eyes to. Now, as I said, the main driver of metabolic syndrome, the cause for it is insulin resistance. What is insulin resistance? I'm going to give you a simple definition for insulin resistance. So insulin resistance occurs when your body, and I must be careful here, when cells in your body, because you have many different cell types. You have fat cells, liver cells, kidney cells, and when you become insulin resistant, maybe just one type of cell in your body is resistant and every other cell responds to insulin. And we believe that your fat cells are the first ones that become insulin resistant. So when one cell type or more in your body doesn't respond to insulin, that leads to a high insulin output. So the body begins to not respond and make more insulin. That is what we call insulin resistance. And there are three main reasons why this may occur. Three reasons why your body begins to stop responding to insulin. And here are the three reasons. I'm going to go through them very slowly because herein is your foothold. Herein is the handle that you're going to hold on to get rid of your problem. If you miss any other slide in this presentation, don't miss this one. So the three reasons why your insulin is high, why you have insulin resistance are: one, and these are very important, all of them, chronic stress. So if you're stressed chronically, whether it be a bad marriage, a job you hate, kids that are driving up the wall, chronic poverty, yeah, so you have money problems and you can't find its meal. Chronic stress can give you insulin resistance and lead to pressure and sugar. That's what we're saying, right? So just be careful now. So think about all the reasons why you may be, and when we say chronic, we mean long, ongoing. In medicine, chronic tends to mean 6 months or more, So chronic stress is a cause for insulin resistance. How does this occur? For the medical doctors here, your body produces two stress hormones, cortisol and epinephrine. And these are useful in the short-term setting, in the few weeks or days of stress, an exam coming up, a job interview. It's fine to have elevated levels of these hormones. But when they're chronically elevated, they cause problems. Now, these two hormones are not really related. They are produced by different cell types. They have different impacts on the body. They are, different in how they appear. One is a steroid hormone, and one is from an amino acid that is produced from. So cortisol and epinephrine are two different hormones, but they are called stress hormones. They have one commonality. What's the commonality? They both try to elevate your blood sugar. So once released, they try to elevate your blood sugar to give you energy to deal with the stress. And if they are chronically elevated, they're going to chronically send your blood sugar up. And that's going to lead to a high insulin output to deal with the blood sugar. So stress, yes, can send your blood sugar up, your blood pressure up, and your cholesterol, and all the other problems that come with insulin resistance. So yes, the eating healthy exercise is important, but handling your stress is no less important as you try to reverse your insulin resistance and get rid of your diabetes, hypertension, your cancers, and so on. And I'm pleased to say that people who have joined our challenge, 21-day, 14-day, 90-day, have been exposed to stress-relieving meditation, relaxation, calming techniques, which is going to be key in your journey to health. The second cause, and I've beaten this horse dead over the past 2 years, the second cause of insulin resistance is chronic inflammation. Now, inflammation generally is a term that we use to describe an immune system response, but that's not what I want to talk about this evening. Inflammation generally occurs when your body or cells in your body release certain chemicals that may or may not have anything to do with your immune system. The most two common scenarios where this occurs is in your fat cells. Now, we know that persons who are obese tend to have more insulin resistance, and insulin resistance may make you obese. When persons get fat, their fat cells are what tend to get bigger. They don't necessarily make new fat cells. That's very rare. You tend to be limited in the amount of fat cells you have. They tend to get bigger and bigger in your fat cell size as you put on weight. Now, as these fat cells expand, they have greater and greater difficulty holding the amount of fat in the cells and getting blood flow. So in an attempt to survive, what the fat cells do, they will burst, little holes will appear in the fat cells, leak out some of the fat, and leak out inflammatory molecules like IL-6 and tumor necrosis factor alpha. These are for the doctors and nurses and medical students now. And these are inflammatory molecules that bathe your entire body in inflammation. Well, one of the consequences is that it recruits blood vessels to come to feed the fat cells so they can continue to grow. But this inflammation, when it impacts any cell in your body, and they have done this in vitro and in vivo research to find that once inflammation in your body increases, your body becomes insulin resistant. So inflammatory molecules increase insulin resistance. Another two common places where you get inflammation from is your gut. So if you have chronic poor gut health, acid reflux, gas and bloating, IBS, you're eating a nutrient poor diet with lots of processed foods, you're gonna have gut inflammation. And that now bathes your body in inflammation, making you insulin resistant. Another one, importantly, your mouth health, your oral health. If you have gum problems, gum disease, that's a source of inflammation, which we doctors know will give you heart disease. But bet you didn't know it causes insulin resistance by bathing your entire body because the inflammatory molecules get into your bloodstream. So in reducing inflammation, you have to take care of your oral health, yes, your gut health, and making sure that your fat percentage on your body is low. That's going to be key to reversing your diseases that you have. So you cannot be exercising and eating healthy and your gum is rotting. That's going to cause problems. You're going to have chronic inflammation and you'll never see that blood sugar go down. It will be high. And that's the same mechanism by which infections cause high blood sugar. So a patient who goes into hospital with a foot that's having an infection or a lung infection or a flu, you will find that patient's blood sugar will go up and will be very hard to get down until that infection goes up, because infection leads to inflammation, and inflammation makes you insulin resistant and your blood sugar will spike. The last one, the third thing now that causes insulin resistance, which may be the most important one, is insulin itself. When your insulin is too high, that makes you insulin resistant. I hope I'm not confusing you. Let me give you a little analogy now. I used to live in a place named Tarspin, right? That's in Spanish Town in St. Catherine. It was an inner city neighborhood, and I lived in a tenement yard. In that tenement yard, there were like one, two, I'm looking in my eyes now, one, two, three houses. And in one house where I lived, there were two families in one house. And there's a little boy in that house that him rude gone to bed, him get beaten every day. He was the rudest little boy I know, but him get beaten every day. And after a while, he realized him getting the beating and him just now ball, him just stand up and take a lick. Because he had gotten so much beating, he stopped responding to the beating. And the method of punishment graduated from a simple slap to a belt, to a fan belt from a car, to a board, to stone. Yeah, that child went on some serious abuse. He's in prison now, by the way, serving a life sentence for murder. Um, so the fact is that when you beat the pitney too much, the beating have no use to it. So when you bathe your body in chronically high insulin, insulin becomes useless. And how do you bathe your body in chronically high insulin? By eating too much sugar and carbs. That's what makes your insulin goes up. So there are three kinds of nutrients you take in your diet: fats, protein, carbohydrate. Fats barely trigger insulin. Yeah, barely. Protein a little bit, but carbs, sugar, flour, rice, that triggers insulin. And this comes now to a very important point. I'm gonna cut this part out and make a video of it. So listen now, people on TikTok. Listen to me now. Jamaican people, and I'm saying Jamaicans, have a high carbohydrate diet by definition. That's how we eat. In the morning, we get up, we drink tea with sugar, carbs. We have to eat some bread, carbs, with maybe some eggs on it or something, right? If we not do the egg and bread, then we're gonna be doing cereal, which is carbs. Or if we do that, we're gonna make some fried dumpling and some plantain or some bami, carbs. Some of us want to be sophisticated and drink orange juice, carbs. Then we go after lunchtime. What we have for lunch? Oh, more orange juice, carbs, rice, carbs, or some cooked food, dumpling and yam, carbs. Then it's dinner time. We're gonna have rice, carbs, or cooked food, carbs, with some juice, carbs. If you're old, guess what you're gonna do? Crackers, carbs, tea, carbs. We just overindulge, hence why most of us have metabolic syndrome. If you go to England, it's no different. Tea and some pastry. America, croissant, bagel, Japan, rice every day. So yeah, the people in Japan, higher rates of diabetes, eat too much rice. Bet you didn't know that. So when I come on the TikTok here and come on the platform and burn out these foods, I'm not burning them up without data. Now, listen, if you have no metabolic syndrome, you have no diabetes, no hypertension, it's fine to eat a little bit of carbs. And our grandparents did eat them and they didn't have the rates of diabetes that we have now. Guess why? Our grandparents lived outside. They walked to school, they walked to the bushes, they did everything manual, they worked from sun up to sundown. They had a lifestyle of activity. They needed lots of carbs. Back in the slavery days, they needed carbs. They were working. What are you doing? Sitting down for the entire day. Why do you need so much carbs? You don't. And that is one of the main reasons why we're sick. So if you're active and moving around, farming, doing manual work, yes, eat a dumpling, man, eat a rice, you need it. But for the majority of us who live indoors, who do office-based work in a call center, work in a bank, nurses, doctors, we do not need so much carbs, and the inability of our bodies to get rid of it, we can't burn it because we're not doing exercise, is the root cause of our problems, as you have seen. So do not miss this slide. All right, let me move on to the next slide because there's a lot to get through and we have limited time left. All right, so yeah, so I've done that already. Let me go on. So on this slide, what I could highlight a little bit on this slide was that insulin resistance leads to a number of conditions, and I'm going to go through them one by one for each presentation. So we have presentations talk about type 2 diabetes and insulin resistance. I'm going to go into diabetes and tell you how to reverse it. I'm going to tell you tonight too, so pay attention, don't leave. Follow the page so you get notified when we go live again. And I must acknowledge the people who are on Zoom 185. TikTok is up to 500 now. People are tuning in. Thanks so much. Please follow the page, people. Everybody follow the page so you can be notified when we go live. And for following, I'm going to send people on TikTok this presentation. Just send me a message with your number on WhatsApp and we will send the presentation to you free of cost. You can have all the slides for yourself to look at. As a matter of fact, I'll just send you the link and you'll have to download it yourself from my Gamma page. Type 2 diabetes, we're going to talk about obesity, how to lose weight easily. And let me stop here and talk about weight. And I'm gonna say this. This is a big thing now, guys. I'm gonna tell you the secret to weight loss that I've been holding back for so many years. I never tell you this before. Listen to me, I say. Doctors, nurses, listen to this one carefully. Now, there is a patient that we all know of as doctors who comes to the office who will tell you that they are passing lots of urine, they are thirsty excessively, drinking lots of fluids, including sugar. They are hungry all the time, eating down the place, and they have lost 30 pounds in 2 weeks or 30 pounds in 1 month. That's a type 1 diabetic patient. When a patient comes with that massive amount of food being consumed, massive amount of drinks being consumed, and losing weight drastically, can't put on a pound, that's a type 1 diabetes patient until proven otherwise. Why is that patient eating food and not putting on any weight? Because that patient has no insulin. So here is the thing. You cannot put on weight without insulin. It's impossible. You cannot store fat without insulin. So to store fat, you must have high amount of insulin. That is the key. So listen now. So if your insulin is high, you cannot lose weight. That's the opposite. So if you're trying to lose weight, you're starving yourself, eating 1 meal a day, and your weight is still up in the air, what it simply means is that your insulin is too high. There's no other reason. And you need to get your insulin down, and you will lose weight effortlessly. So for example, I said, but doc, I'm on prednisone, and that's why I can't lose weight, which I found out today with a patient. What does prednisone do? It's a steroid. What does it do? Increase your sugar, which increases your insulin. That's why you can't lose weight. Every cause of weight gain has to go through insulin. Oh, it's your thyroid. Well, your thyroid reduces insulin sensitivity. That's why you can't lose weight when you have thyroid problems. So that is the key. So if you can get your insulin down with what I'm going to tell you, then you can lose weight. Secret bustle. So the diabetes presentation, obesity presentation just got shaken out right in front of you. We're going to talk about hypertension. How does insulin cause hypertension? Now, when I was going to med school, we were told that there were secondary causes of hypertension and something called essential hypertension. So secondary hypertension was caused by diseases that we know of. Inborn errors with your aorta, hyperthyroidism. You may have a pheochromocytoma, tumor of your adrenal gland. You might have some kidney issues that you're, born with polycystic kidney disease. You have a few other causes, and then that would make up 5% of hypertension. But the other 95% was caused by essential hypertension, which essentially means that we don't know what caused it. Secret, no go so. When you have high insulin, it does two things. One, high insulin blocks your body's ability to produce nitric oxide. So that makes your blood vessels constrict. And if they constrict, you increase what we call vascular resistance. That raises your blood pressure. High insulin makes your body retain salt. Retain more fluid, so the blood pressure goes up, so blood volume goes up, the stiffness in the arteries goes up, and so your blood pressure goes up. That is the cause. That's how insulin causes high blood pressure. And majority of cases of hypertension, if it's understood and treated in that way, will vanish. I'm giving you too much information. Never come back for the other president. I'm teaching too much tonight. I'm not teaching anymore on this. So we're going to talk about how insulin causes dementia, how insulin causes PCOS, why the young ladies are so thick and infertile and having hair growth on their body. I'm going to talk about that in a presentation coming up. I'm not going to tell you when you have to join every single one. Follow the page. Next 2 weeks, we are live again with the next presentation. All right? High cholesterol. How does insulin cause high cholesterol? It's not pork and chicken and beef that you eat cause high cholesterol. It's your high insulin that causes it. Yes, surprise, surprise. American Heart Association, maybe 2 years ago, came out and finally said eating eggs does not raise your cholesterol. And we know that for a long time, but you never knew that. You're told not to eat eggs, that nothing no go, so it's a high insulin. Anyway, I'm gonna go down quickly now to the bottom to talk about what to do about the high insulin. I need to wrap up quickly. 47 minutes in. There are a lot here that you'll get on the slides. I'm gonna just skip over a lot of what is here. It's really just repetitive information, things for the doctors. Now, how do you know you have high insulin? How do you know you have metabolic syndrome? There are some clinical observations that you can make. So even if you're not a doctor, you can pick these things up. So one, you will find that after a meal, you feel tired and sleepy. So we call that niggeritis in Jamaica. Medical terminology, postprandial somnolence. Your high insulin in the presence of a meal will drop your sugar down rapidly. So you eat food to raise the blood sugar to feel energy. Insulin inside drops sugar down rapidly because some of your body tissues do still respond to insulin. And that makes you tired and fatigued. So if you're eating food and then you're tired afterward, niggeritis, it means the insulin is too high. Maybe you had a high carb meal, that's sending insulin up high. If you're having sugar cravings, that's a sign that you might be insulin resistant. If you have belly fat, lots of belly fat, sign of insulin resistance. Gaining weight rapidly without eating more food, insulin resistance. Skin tags, little wart-like projections of your skin around your neck and in your armpits and in your antecubital fossa, insulin resistance. Acanthosis nigricans, velvet black skin around your neck. So you put on some weight and you realize the skin around you. So when you finish, look in the mirror, look around the back of your neck. Is it smooth and velvety, wrinkled like tissue paper? Insulin resistance. Is your uric acid high on your last executive profile? Insulin resistance. And finally, something that we need to start doing, that then we'll get tired of me doing, is checking your insulin levels in your blood. Yes, there's a test called a fasting insulin. Ask your doctor to check it. The ideal level is supposed to be 5 or less. If you check most lab forms in Jamaica, you'll see the level between like 2 up to 20. They accept 20 as normal. Isn't that normal? That is not normal. So that needs serious revision. 20 already insulin resistance a long time and probably soon be diabetic. You want to catch it before it start going up beyond 5, right? And if it be above 5, try to get it down. That's how you're going to reverse your problem. If you're diabetic for many years and you get it in the region of 2, you know, say, boy, things bad for you because you're not making any insulin. So by that time, you're type 1 diabetic. All right, moving on. There are some additional tests here which I'm going to skip over. I'm going to spend time on all of these tests that you need to be doing. All right, so in trying to address insulin resistance, there are some things you need to be doing to reverse the curse. Please follow the page so you're notified when I go live again. If you're on TikTok, if you're on YouTube, please follow the page so you can be notified when we go live, because we're going live every 2 weeks and you don't want to miss these presentations, because I'm going to announce just a couple days before what I'm talking about. I think next 2 weeks, talking about insulin resistance and diabetes, if my memory serves right. So if you're diabetic, follow that one. 2 weeks time. Refined carbs is going to be a problem. So we're talking about your flour and your rice, your cornmeal, your oats. Seed oils as in canola oil, vegetable oil, soya oil, corn oil. These oils have been shown in animal models and in vitro, in lab tests, in cell lines, to increase insulin resistance because they are inflammatory. So we haven't had any good human studies that confirm these are going to promote insulin resistance, but by extrapolation, it might be wise to avoid them. Coconut oil is pretty good in this respect. Lots of lauric acid. A diet that's low in fiber is gonna cause you to have a poor gut health, and that will give you insulin resistance. You want to have high fiber diet. So basically, you want to cut the carbs, cut out all refined carbs, and cut the non-refined ones significantly. If you have these problems, avoid the seed oils and just have a little bit of oil generally. But olive oil and coconut oil are great oils to have. Avocado is great as a fat source, where most of your calories should come from. Have lots of fiber to have good gut health and low inflammation. Take care of your teeth and avoid this thing they call high fructose corn syrup. High fructose corn syrup is the leading cause of high uric acid and fatty liver disease by the same mechanism of promoting high insulin. Yeah. Because fructose really breaks down uric acid. It's one of the breakdown products. And that causes heart problems and so on. So avoid refined sugar, processed foods, and stick to whole foods that are rich in fiber. And use your healthy oils. Move, exercise. It's really key. And aerobics and jogging and walking is better than nothing at all, but it's not enough. What you need is muscle. The more muscle you have, the more insulin sensitive you are. But here's an extra. Muscle have some what we call GLUT4 transporters that do not depend on insulin to absorb sugar from your bloodstream. So your muscle can take sugar out of your bloodstream without insulin being present, or without you even can be sensitive to insulin. So if you have a lot of muscle and you're diabetic, you're more likely to become non-diabetic if you're changing your diet. So muscle is going to be a key ingredient in your long-term metabolic health. You have to exercise resistance training to build muscle. Sleep is really important. One night of missed sleep can raise your cortisol and your adrenaline levels and make you insulin resistant in one night. One night. But equally, one good night of sleep can reverse it, if that was the cause. But imagine the persons who are not sleeping for months and years, missing sleep. That can make you insulin resistant. That's one of the secondary causes because it goes through cortisol, it goes through sugar and goes through insulin. So it's not a primary cause, but poor sleep. So getting enough sleep, Miss Barbara Lee Sangai, you're watching, you say not sleep, I call her name, why sugar and go down. Yeah, so you want to basically be avoiding foods that are bad for you and eating foods that are great for you. And we have a diet plan called a Reverse It Diet Plan, which is free. So if you're on TikTok, you need to touch up to the top here, so this, my name, yeah? You touch on that and it will take you to my main page, and you will see on my main page, the Linktree Thomas Medical Center. If you click on that, you will see Reverse It, and it's a free diet plan with over 30-odd pages of recipes that I've put together for you to get your diet under control. Free recipes for breakfast, lunch, and dinner. I have one section for vegans, one section for non-vegans. In the vegan section, I have Jamaican, American, and British recipes. In the meat section, I have Jamaican, American, and British recipes. And if I get people from Africa, I'll do some African recipes too, because I have friends who can tell me what them eat. So I have a free diet guide called Reverse It Diet Guide on my page. So follow the page, guys. Click on my name and click the link in my bio, which is the Linktree. And you scroll down, you'll see how to get that Reverse It Diet Guide. Click on it. Boom, boom, boom. It's on your phone. You can download it, use it for free. It's updated regularly. You can have that as a resource. So don't tell me you don't know what to eat. That document has maybe 20 smoothies, 30 breakfasts, 30 lunch, and 30 dinners. What more can you ask for? I've done it for you. I can't eat the food for you. Eat for yourself. So exercise, we talked about that. What else we're going to talk about? Talk about the gut already and the importance of eating fiber, and then we need to add in the probiotic foods. We're going to talk about here now sleep. We talked about that already. And yes, finally, this is the last slide. I'm going to go to the last slide. Finally, some supplements. I know you all want to hear about supplements. So what supplements are you to take to improve your insulin sensitivity or reduce insulin resistance? Now, before I talk about supplements, there's one thing I need to talk about. There's one medication that enough people hate, but actually like that medication. It's the one medication actually can actually help you with the diabetes. It can actually help you reverse the diabetes if you know how to use it. That medication is called metformin. Metformin is a medication that increases insulin sensitivity. It's a drug, and I know you don't want me to talk about drugs. You know me, a natural doctor, an herbal doctor. No. Metformin is really, really good. Metformin is the only medication that reduces your insulin. See the other one, them? No, for the other one, them increase your insulin. Just make your insulin resistance worse, right? But metformin is very good. Metformin is found by itself and in combination with Galvos and some other things. It's a very good medication that actually will reduce your insulin, make you metabolically healthier. But more enough about that. Omega-3 fatty acid is going to be key to reduce inflammation and reduce your triglycerides. Where you get it from? Fish like salmon and sardine and mackerel and cod, them having omega-3. Yeah. And you can get it from pills. And if you're a vegan, you know you can get it from flaxseed and chia seed and hemp seeds. Eat a lot of those, but omega-3s are great to reduce inflammation and help to reverse your insulin resistance. Second, my favorite, magnesium. So I've done like tons of magnesium videos, and one of them I think is on here. Go watch magnesium video so you know which magnesium to take. So follow the page and watch a magnesium video because I'm not going to talk about it. Go and watch the video. There's 2 good videos on magnesium on my page. Berberine is a great herb that lowers glucose comparable to metformin and lowers insulin resistance. So that's a great herb. So berberine is the natural version of metformin. Very good. And of course, alpha lipoic acid I have here, not a great supplement. But how could I not talk about cinnamon and fenugreek? These are great herbs to reduce insulin. It's 6:59. There are more slides, but I'm going to turn over to my moderators to be able to take us through the Q&A. I'm going to watch the ones here on TikTok and answer a few. And I'm going to turn over now to Sandrine and Paula to be able to take us through the final 20-30 minutes of this evening so we can answer some questions. So guys, remember, in summary, metabolic syndrome is affecting 25% of the world, 30% of Jamaica. 1 in 3 persons have it in Jamaica. Adults, that is. 1 in 8 of us are healthy metabolically. 7 out of 8 persons have some degree of metabolic dysfunction and are on their way to becoming diabetic or pre-diabetic. It is a crisis of worldwide proportions. The difference begins when we recognize that we are, as a people, doing something wrong. We're eating too much of the wrong foods. We are not sleeping enough, not moving enough. Change is in your hands. You can reverse it. Not by just taking some bush tea. No. Not by praying and hoping. Not by buying it in the name of Jesus. I am a Christian. You can bind it all you want. If you're eating flour and sugar, you're going to be diabetic. I repeat, you can bind it all you want. Pastor, bind it all you want. But if you're eating sugar and flour, you're going to be diabetic. Quote me on that. Over to you guys.
Thank you so much, Dr. Thomas. Can you stop sharing your screen, please? Great information. Now we're going to move on to our Q&A segment, and we will only respond to questions that's based on tonight's presentation. So I will be taking questions from TikTok, from Zoom, and also from YouTube. And so there were some questions in the chat. If you're not yet subscribed to the YouTube channel, you can. It's Top Doc 33, or just type in Dr. Orlando Thomas and you will see his page come up. So go ahead and subscribe. And if you want to share tonight's presentation, it's there under the live tab. You can forward it to your friends and family members who missed tonight's session. So we have over 200 people on Zoom Doc. We have 600 and something on TikTok and 20 something the last time I checked on YouTube. So you can raise your hand to be acknowledged and I'll take your question, or you can type it in the chat. So I'm going to start with this. Actually, there was a question about how do you address sleep when you are a night shift nurse. And I usually tell folks, it's like when you get home in the day, you got to treat it as your night. Still got to have your wind down time to be sure that you are getting your sleep. Use your blackout curtains and so forth to just create that, your room as though you're going to bed to sleep at nights. So Doc, your first question, what do you recommend to help with cholesterol? Don't know if you discussed it already.
Well, we didn't do the cholesterol presentation tonight, but we're saying tonight cholesterol problems is part of a metabolic syndrome, and it's going to be driven by high insulin in many instances. So getting your diet right, getting on a low carbohydrate diet is going to be key. For cholesterol specifically, you want to get your inflammation down. That's a big driver. So I'm taking care of your gut health, your oral health, and avoiding the seed oils and taking instead olive and coconut oil and avocado oil as your preferred choices. There are a couple of supplements I tend to use for cholesterol. One of them is Cholesterol. It's a little hard to get on the internet now. So Cholesterol Plus is one. There's also one called the red yeast rice. So a combination of those I find are very helpful for cholesterol, but it's gonna be diet and lifestyle change, getting your inflammation down, getting the carbs out your diet that will send your cholesterol down. It's not by avoiding meat that will get your cholesterol down. Your liver produces cholesterol, so you want to get your liver working metabolically well, and that will be your savior. All right.
All right, thank you for that answer. And just a reminder for individuals who are asking questions, be sure to note the responses, or you can go back and watch the video that will be posted on YouTube. Next question. I am diabetic and high blood pressure and fatty liver and heart problem. Because of accident and surgery that the complications I have to live with, I alone can eat smoothie and soft baby food. What are your suggestions?
Well, yeah. So smoothie is a great way to nourish your body. So I tend to have one raw meal and one cooked meal a day. On most days, and my raw meal is a smoothie. And if you're following me on TikTok, you could go to my TikTok page, and I've pinned that perfect breakfast smoothie the top of my page, where I tend to use greens and nuts and seeds and coconut milk along with my spices and my pink salt to make my smoothie. And I do that every single day almost. If not every day, maybe 5 days a week, I'm having a smoothie for breakfast. So I'm a big believer in smoothies. I'm a big believer in simple to use foods. Fruits are great if you have the right low glycemic fruits. So, but try to avoid the porridge and carbohydrate rich foods that we tend to call baby foods in Jamaica. I tend to go for smoothies and use real foods to make them. So I'm a big believer in that. I saw a question on TikTok asking about berberine. So I just want to quickly just say berberine dosage is usually about 1,500 milligrams max per day. You want to take it maybe 2 or 3 times a day, maybe 500 3 times a day. Is probably the maximum I would go. 500 twice a day may be a great dose, right?
So there are a lot of questions about sweeteners, artificial sweeteners. And I know sugar is sugar regardless of the source. Do you want to address that so I don't have to ask those questions separately?
Yeah, artificial sweeteners are alternative ways of getting your food sweet, which does not include sugar. So there are three options for sweetening. So there are natural sugars, which would be your cane sugar, your honey, your agave nectar. Those are natural sugar substitutes. And then you have natural sweeteners, which does not have calories, like your monk fruit and your stevia. And you have artificial sweeteners like your Equal, your NutraSweet, your aspartame, they have lots of them that you can use. I tend to try to get people off sweets. It takes some time for people to give sweets up. But if you maintain having lots of sweets, whether natural or artificial, it reinforces your sweet addiction, which it is, and you will have a more difficult time transitioning to a healthier diet because you're constantly craving sweets, something that you're addicted to. So you want to wean yourself off sweets in general. So the idea of having sweets is something that I want people to move away from. But if you were to rank the healthiest sweeteners, it would be things like stevia and monk fruit, which are natural and have no calories. Those are healthier options. And the research around artificial sweeteners are controversial. Some people who make them say that they're healthy and they have research to show it. People who do independent research show that they have various metabolic and brain-based side effects. So I tend to avoid them because of that discrepancy in the research. I can't tell you definitively that all the research agrees with they've been bad, but I'm very cautious, so I don't recommend them at all. So I don't recommend anything that says diabetic or no sugar added because they tend to have artificial sweeteners. I tend to go with natural sweeteners like what's in fruits, for example, if I need something sweet. So that's where I go.
All right, Doc, I needed to spend some time right now to talk about the 90-day challenge as well as the 21-day. We have a lot of visitors on tonight, and we want to get some of them to join our challenges. So go ahead.
All right, so these presentations I'm doing, guys, really came out of the need I'm seeing for people to be educated. And in my day-to-day practice, I was meeting persons who were diabetic, hypertensive, high cholesterol. They were suffering, just like some of you, didn't know what to do. And so I had started out counseling persons one-on-one as to how to eat and providing them with diet plans. I had a nutritionist, and she started doing one-on-one and coaching on reversing diabetes. We have many patients who've been able to reverse. But as more people found out about what I'm doing, the demand became overwhelming. And even now, I do videos on TikTok. I did a video the other day, Sister Wellness, and 5,000 people responded to the video saying they want me to help them reverse their diabetes. Now, I can't see 5,000 people. So what we have instead are these online challenges, these usually WhatsApp-based group setting where me and my team will walk you through day by day what to do to get healthy. So we have detailed diet plans and instructions. We don't even have a book that I've written, which is going to be released and be available on Amazon soon. So on Amazon coming soon is going to be the 21-day flat belly challenge guide, and soon to come the 90-day flat belly challenge, 90-day body reset guide. So we have these programs where we coach you day by day, hold your hand, what to eat. We look at what to eat. You have to post it and we tell you, no, eat this, don't eat that. We tell you what exercise to do every day. We help you to meditate. We take you through intermittent fasting. We teach you how to do it. Water fasting. We take you through supplement routines, what supplements to take, when to take them, detox. So we literally have a program that we are in your house, in your workplace with you every single day to hold your hand, to guide you from sickness to wellness. And these two programs are the 21-day flat belly challenge and the 90-day body reset. So you can go to the link in my bio right up here, click my name, and you'll be able to see. And for the persons who are on Zoom, they're going to post a link in the chat in a minute to be able to join one of these programs. So you get not just a presentation, but you get me talking to you almost every single day and my team talking to you, answering your questions almost every single day to be able to coach you. So Sister Wellness, I can tell them that over the past 2 years of the many thousands of patients we have done, countless persons have lost weight. 60, 70, 80, 90, 100 pounds plus have been lost by individual persons. Persons have come off their diabetes medication, including insulin. Persons have come off their blood pressure medications, come off their cholesterol medication, impressed their doctor. I even told a story the other day of one patient who was sent home by her doctor with a bunch of drugs from England, NHS doctor, sent home with a bunch of drugs because her labs were abnormal. Her blood pressure was high, her sugar was high, cholesterol was high, her ESR was high, her uric acid was high. Doctor sent her home to come back in a few months to retest to see how the medications work. Patient came on my program, did my program twice, went back to the doctor, did the blood test, everything was fine. Doctor commented to the patient and said, well done. Patient said, doctor, I didn't take the medication. Doctor said, what did you do? Patient said, I joined Dr. Thomas's challenge, and the results are as a result of the challenge. The doctor was amazed. Guess what? The doctor joined the challenge because she too was on medication that she didn't want to take. So guys, we are changing lives and we can change yours. So if you want some help, come, go to the link in the bio, sign the form for the 90-day body reset. This is a longer program for those of you who have metabolic problems like pressure and sugar and cholesterol. If you just want to lose some fat off your tummy, you can join the 21-day flat belly challenge. And both programs are designed to help you know the A, B, C, D. So what I've done, I've tried to be healthy. And I've written in my lifestyle into the programs with the added research. So I don't know what else to tell you. I don't want all of you to come to my office. I cannot see everybody here, right? I want you to join the program where you get not just a one consultation, but a day-by-day instruction. If it was me, I'd join the challenge. I think it's better than come to the office, if you ask me.
All right, thank you. So the admins, shout out to them. Sandrine, she's posted the link tree for, because you keep pointing to your link in the bio, that's for the folks on TikTok. But the folks here on the Zoom, the link is in the chat to either join the 21-day. Elizabeth just posted that, and also on Linktree to get to Dr. Thomas's social media platforms, etc. There's someone who's asking a question, but she said she's already your patient. So I'm going to ask Kenyan Heights SDA to go ahead and unmute and ask your question. All right, so Kenyan Heights is not ready. SCL, can you unmute and ask your question, please? Your hand is raised. All right, so
good afternoon, everyone. Good evening. Sorry.
go ahead.
Okay, this question is for Dr. Thomas. I would like to know, can the triglycerides and HDL go too low? Another question, the berberine that you had suggested, is it the same thing that is called vervine? That's a natural bush?
No, berberine and vervain are two completely different herbs. They are not related at all. So no. Berberine is something that you'll have to buy. I've never seen it growing locally in Jamaica. I'm sorry. It might, but I've never seen it. Vervine does. Vervine is one that has that purple flower. There's a lot in COVID. All right. So you're asking about what's the other question you asked?
Can the triglycerides and HDL go too low? I've been using a lot of coconut oil and omega-3, and on my last executive, those were very low.
Yeah, a triglyceride is supposed to be pretty low. Can it go too low? It's not of any serious consequence if your triglycerides goes low. It's an energy source, and it has other benefits, but if it goes too low, your body has the ability to manufacture more. Your HDL is what we call your good cholesterol. You don't want that to be low because that's going to be protective for your blood vessels and your heart. So you want to get HDL up. You say using
I'm
coconut
sorry,
oil and
sorry,
olive oil.
I'm sorry, Doc. Sorry, it's a mistake. The bad cholesterol, can that go too low, and can the good one go too high? Sorry.
You want the good one to be very high and the bad one to be very low. That's really ideally what you want. So the bad one is really, really low. Yeah. What can happen though, if you're taking cholesterol lowering drugs and you artificially drive it down too low, what you do is you reduce the availability of raw material for your body to make important hormones. So your body uses cholesterol to make the cell membranes for your cells, especially in your brain, uses the cholesterol to make hormones like testosterone, estrogen, progesterone, cortisol, DHEA, uses the testosterone, the cholesterol to make vitamin D, the most important vitamin in your body. And your liver has a remarkable amount of intelligence to regulate the cholesterol level in your body. And when you drive it down artificially too low for too long, evidence suggests that it may increase your risk of dementia because your brain doesn't have enough cholesterol to make the membranes and the coverage for the myelin sheath and so on. So if it's down too low because of diet, your liver is doing its job because your diet is so good, you don't need a lot of cholesterol. You don't need to have that much being pushed out. But if you're taking a drug, then yes, you might need to pop off the drug if your cholesterol is going too low. But generally, I've never seen a cholesterol go too low by just eating healthy. It probably is okay. If the LDL is very low and the HDL is very high, that's ideal. And we tend to have what we call a cholesterol HDL ratio. You want that to be really low. And if that is low, then that's pretty good.
Okay, thank you.
All right, Doc. So can you repeat? I'm not sure if you had said it, but your WhatsApp number. So we're getting a lot of folks on TikTok. They want to join the 21-day challenge, but they're unable to locate the link in your bio. So can you please state your WhatsApp number?
All right, so let me go again. The link in the bio is up top. So go to my page, go to my name at top here, click on the name, and you'll see in the fine print at the top of the page something more Linktree/Thomas Medical Center. Click that, and that will take you to a page which has all of these tabs. You click on the tab. The WhatsApp number, I know TikTok has been a little bit problematic with giving out a number, but I'll take a chance. I'll give it one time. So listen carefully. One time I give it. It's 876. It's a Jamaican number. Write that down, 876. And then the next three digits in the number are 583. That's 583. Once you've gotten that down, the last four digits of the number are 5632. 5632. I will not repeat it. I don't want to get any problems. So that's it. But the link in my bio is click my name and then you will see my page come up and you click the one only clickable link under there that says Linktree/Thomas Medical Center. And on that page now you'll see all the links to join the challenge and to buy my book. And the new one is coming out soon. The 21-day Flat Belly Challenge Guide is being edited now. You'll get to make an appointment for specific things and you'll be able to join the other pages and all the things that you want to do to connect with us. And you can WhatsApp my phone directly from there. Not me answer all of them still, but you can WhatsApp me directly from my Linktree also. All right. So we're at 7:20 now.
Yes, so
Go
it's
ahead.
time to wrap up. So I'm going to take one more question from here and then I'm going to allow someone else to unmute. So Dr. Goodnight, for a person who's insulin dependent for 20 years, but lately keep going into diabetic coma, what likely may cause this?
Well, so a person insulin dependent for 20 years and they're taking their insulin. So I suspect the person's blood sugar is going too high. Is that what they mean, diabetic coma? Yeah, so maybe so the person is becoming insulin resistant because you're taking insulin. That can happen, and so the response of your doctor might be to give you a higher dose of insulin. Which is unfortunate because what it means is that you're eating too much carbs and you need to cut the carbs and then your insulin need will go down. If you don't eat any carbs, you don't need much insulin. So people are afraid to call it the ketogenic diet. People say, oh, ketogenic diet is bad. Well, it's what's going to cure your diabetes and your hypertension. If you go keto or near to it, you're going to have problems. So there are modified versions, there are vegan versions. You don't have to eat pork belly and all these things. You can eat healthy fish and so on, and vegetables and, sardines and salmons and so on, and eggs. All these are great foods that you can have on this diet. And you have all of the vegan options in the diet plan that I made for you. So what you need to do is to really reduce your carbs. Type 1 or type 2 diabetics, insulin dependent or not. If you reduce your carb intake, you reduce your insulin need and reduce your risk of going into into diabetic coma. You can also have too much insulin and that drops your blood sugar too low. And you can go into coma that way too. That's probably even more common in a person who is on insulin. So you may want to reduce the insulin dose in that respect, not to eat more, because eating more with insulin means you're going to put on weight. Insulin makes you put on weight. Remember that. So if your sugar is going too low, you need to cut your insulin level down. So you need less insulin. So I don't know exactly what the issue is, but it can be treated by reducing your carbs or reducing your insulin. Either one is fine, depending on the situation.
All right, Francis Johnson, you can unmute and go ahead.
Good evening, everyone. Doc, I have joined your challenges 2 times, but I've slackened up a bit. Nonetheless, I did an executive the other day, and the A1C was 5.6. What is that considered now?
Considered borderline. So by international standards, normal A1C is 5.6 or less. 5.7 to 6.4 is pre-diabetes, and 6.5 and over is diabetes. Once you pass 5.6, as far as me concerned, you're becoming diabetic anyway. So 5.6, you're just on the borderline. So you're not doing too bad, but I'd love to hear next time you tell me this is 5.1 or 5.2. So push a little harder and you get it on some more because you're on the borderline, which is a little closer comfort. All right, but you're not in a crisis situation right now. What you might have though is a high insulin, which you may want to ask the doctor to check. So check your insulin also and see if it's too high, and then you want to even push harder to get your insulin level down. All right?
Okay, I'll join the challenge again.
All right. So
All
the
right.
next in the chat, there's a question on TikTok. Is eating nuts such as cashew, almond, pistachio, does that contribute to high sugar?
Nuts are very minor source of carbohydrate. They are more known for their fiber and their protein and fat content. So they're not going to trigger insulin a lot, to be honest. So nuts are a great way to consume foods. You don't need a lot of nuts. Your nuts are primarily for your vitamin E and your minerals. So vitamin E is for your brain, prevent Alzheimer's. A handful of nuts is all you need per day. It's for your zinc, to help your prostate and your immune system. They are for the healthy oils. They provide energy and so on. So you don't want to go eat a cup of nuts per day. Too much of one thing is good for nothing. So nuts are going to be a great source of nutrients, which will not spike your insulin. So that's nuts and seeds, vegetables, low glycemic fruits like your berries and cherries, your auto-eating apple, your papayas. These are great fruits to have. Avocado, my number one favorite fruit of all time, is very low glycemic, rich in fats, healthiest fruit ever. Yeah, so those are things that I recommend highly that you consume daily.
Thank you. Canyon Heights, are you ready to unmute? All right. All right, Doc, you can, again, folks still asking about joining.
All right.
Go ahead, please.
Hello, Walker, go ahead.
All right. There's another
Let me
question.
ask the question again because I have someone with me here, a client. So give me about 10 minutes to come back.
We're going to be finished by then if you don't ask the question now. All right. There's a question. Good night, Doc. What time is best to take cinnamon? I am a PCOS patient.
Cinnamon is gonna be great to reduce postprandial blood glucose. So it prevents your sugar from spiking after you eat. So you take cinnamon with your meal. So you have cinnamon 3 times a day if needs be. So with your breakfast, lunch, and dinner, if you're doing 2 meals a day, you have cinnamon 2 meals 2 times a day. So cinnamon tea accompanying your meals is a great way to prevent that sugar spike and that insulin spike. So if you're eating some carbs, cinnamon gotta go with it. If you're eating some beef, tomato gotta go with it to prevent all the negative effects. You know, say twin the foods like that. Cinnamon goes with your carbs.
Our next
All right.
question, what tests can be done to know if my insulin level is high?
Well, we check your insulin levels. It's called a fasting insulin test. It fast overnight, maybe after 8-hour fast, and you check your insulin levels, blood draw in the morning, and we know what it is. In Jamaica, we don't test it directly, we send it overseas. I'm sending for a lot. So Biomedical and Central and Alpha and Microlabs are seeing lots of requests from me. So I'm sure they're gonna start buying equipment to test it locally now, because I'm gonna make sure that not myself only, but my doctors in Jamaica start testing insulin. You can test. And once you know your insulin level, then you're on the road to reversing insulin resistance and reversing type 2 diabetes.
If someone's pancreas is challenged by cancer and diabetes, it's now an issue, what is the best herbs to use daily?
That's a complicated question. I don't think I can attempt that one at all.
All
Pancreatic
right,
cancer is
please don't.
serious. I'm not gonna take that one on. So I need
So
to.
let's answer, does vitamin D help with insulin sensitivity?
A little bit. You know, there are genes that do control insulin sensitivity, and some persons who are from diabetic families may be predisposed genetically to having insulin resistance, like myself. And so having a healthy vitamin D levels help to epigenetically turn off some of those bad genes or make them underexpress themselves. So yeah, so from a genetic perspective, vitamin D is really key in preventing insulin resistance indirectly, not directly.
All right, so we're going to wrap up in 5 minutes. Doc, are there any closing thoughts, any questions, and then, last minute questions that we have about joining the challenge? Or Doc, I'll just allow you to take this time to wrap up. And I want to say thank you to everyone who took time out of their busy schedule to join us tonight. Not next week, the following week, Sunday, we'll be meeting again. It's going to be the same link, same password. Invite your friends and family members and anyone you think will benefit from our seminars. So thank you. Over to you, Doc.
All right, so in closing, everybody, it was wonderful to have had so many of you out tonight. I would say maybe it was one of our most well-attended sessions on TikTok and on Zoom. So I'm pleased to see the interest. I promise you that if you continue to support the page, follow the page, support our live, support the challenges, I'll make these presentations richer and more interactive and more knowledge-filled, more filled with information each and every time I come on. So I'm gonna make you that promise to make sure that I teach you something that will change your life completely. So your task is to follow the page, share the videos with as many persons as you can so the knowledge spreads and persons, your medical colleagues, your doctors, your nurses, your nutritionists, your taxi driver, your Uber driver, your neighbor gets on a life-saving program. Not necessarily with me, but we are too loose with how we live, and so we are dying like flies, unnecessarily. So all of you, I expect to be ambassadors of great health, ambassadors of this kind of knowledge that we are actually putting out. I'm not the author of any of this. I am a researcher, and I implement what I find out in my research. And sometimes I try a few new things, and then I see the results in my clients, and I come and report them back to you. So all I'm saying are things that I've seen personally work. They do work. And so I'm confident that what I'm teaching you will help many people here. So it's up to you to remember that your health is in your hands. Your chronic illnesses are not your fate forever. you can begin the process of reversing many diseases that you thought irreversible. I'm gonna get a lot of pushback. I'm gonna get a lot of persons who don't agree with me, but the science is pretty clear, and I stand on strong science when I make these bold statements of persons getting rid of diabetes, hypertension, and high cholesterol. And if you are interested, you can do the research. If you're on my Zoom, you'll see every single slide had journal articles from which the information came. I cited immense number of articles to put these presentations together. So you can reach out to me if you're a medical doctor for the slides also, and I'll provide them with you and some of the publications that I've read. Prepare for this. This is information that I want everybody to have for free. And I hope that pretty soon I'll have some more of my colleagues joining me to do these presentations. So tonight, everybody, follow the page, join the challenge, so you can begin the process of changing your life. Good night. Take care. Walk good.
Good night, everyone.